Welcome to today's session, which is on children's social care, and we are taking oral evidence from two panels this morning. First of all, John Pearce, the President of the Association of Directors of Children's Services, and Councillor Roger Gough, Children's Services Spokesman at the County Councils Network, as well as remotely Stuart Ashley, the Director of Children's Services at Hampshire County Council. You're all very welcome to the committee. Can I ask, first of all, how significant is children's social care as a factor in rising local authority spending and indeed deficits? Perhaps Roger, if you want to start off on that.
The short answer is very and it's growing impact. So historically, when people have spoken about pressures in local authority budgets, a lot of the focus has been on adult social care. Now, very often, actually in recent times, the pro rata or the percentage increase for children's has been greater, and it is a growing impact. So for our members at the County Councils Network, it's now nearly a quarter of total spend. It was a few years ago, it was a bit below a fifth. So it has increased significantly. Overall, it's almost doubled on a per head basis of spend over the last decade. So it has been a very, very significant increase. And late last year, County Councils Network set out their estimates of the spending pressures that there were, the overspend pressures, and about 45% of our overspend pressures were in children's services.
And that's pretty much universal across upper tier local authorities, isn't it?
Yes, I mean, there'll be slight variations on the theme depending on what exactly is driving it. Some will have slightly different trends on underlying numbers, but perhaps what is most common is the unit cost pressures, which are very severe.
John, do you want to add anything on that?
Yeah, no, so I would absolutely agree with that, and I think what we've seen is a really substantial increase in two areas. So the predominant area around children in care placements and the increase in particularly very expensive placements for those children with the most complex needs and the challenges that we have within the residential system. That's compounded by an overall increase in numbers as well as complexity. And then in a lot of areas we're also seeing significant pressures driven through workforce challenges and challenges in terms of availability of and sufficiency of social work staff, and also some of the agency fees around social work staff.
Can I bring in Stuart from the Hampshire perspective? Is that a picture you recognise from your experience?
Yes, absolutely. It's a picture I recognise. Let me give you some numbers perhaps to prove the point. 2018-19, Hampshire was spending £142 million on children's social care. At the end of this financial year, that's gone up to £264 million. So really significant increases in spend, all of that driven by demand. And as John rightly said, the real pressure comes from the cost of looked after children's placements, which have grown exponentially.
Thank you. And the spring budget included 500 million worth of funding for local authorities, with 165 million specifically for children's services. How far does that go to helping local authorities deal with the rising costs of social services?
I think the answer is that it was useful, but doesn't address the underlying issue. So it was certainly very welcome. If I may step out of character in a moment from CCN and just take my own local authority, Kent, that package was worth, from memory, about 13 million to us. Now that was, that's in the context of an overall budget for my authority of 1.4 billion, and spending pressures, which are clearly in the very high double-digit millions. So it was useful, but also, as I think you indicated, not all of it was related to children's social services either. So whilst it was helpful, it was, again, a one-off and limited solution.
Anything to add to that?
Yes, I mean, we see a very, very similar picture in terms of that. I see it very much as a sticking plaster, which extremely welcome. But if you look at the context of an LGA forecast, which talks about a £4 billion shortfall, 500 million in that context provides some respite. And certainly for some authorities who were looking at a position where they were really struggling to understand how they could balance the books in year. We know increasing numbers of authorities are looking at 114 notices or additional financial support directly from government, and I think that's mitigated the risk around some authorities. Looking forward, I think a lot of authorities are planning over a 3 or 4 year cycle in terms of their financial sustainability, and particularly it's the case in my authority, as in most that I talk to, the 25-26 onwards forecasts within the budget figures are the things that give us real concern, and the IFS estimates that talk about that potentially being a 3.5% cut to funding to unprotected areas like local government at a time when we're seeing really substantial increases. And at the moment we're having to plan on that basis because we're working on a 3 or 4 year cycle, similar to Roger's reflection from his authority. In my authority, the allocation from that 500 million was about half my in-year overspend. Right. So that gives you a sort of feel of the scale of it.
And I mean, I presume similar challenge in terms of Hampshire, but just in terms of the other challenges in this space, I guess in the past, when local authorities faced a challenge in children's services, they were able to cross-subsidise from other areas. Certainly the issue I hear from my county council is the concern that they face deficits in multiple areas, in adult social care, in children's social care, in home-to-school transport, and in SEN. And we see in the special educational needs space the government investing in programmes with safety valve and delivering better value, specifically to help manage those deficits, but they don't seem to have ever turned them around, or in very few cases. What would, I guess, turn things around in this space? And also, can I just ask, you mentioned Section 114 notices. I mean, clearly we've had the example of Birmingham where a Section 114 notice then followed by very substantial cuts to children's services. How does the system cope with that? And how do we make sure that statutory duties are actually still delivered on in that context?
The real risk in the system for how they cope with that is that the discretionary spend, the spend that we know has a real long-term impact on prevention, on early help, is the area that gets reduced, and that is a false economy because in effect it stores up costs further down the line. It's really bad for children and families. It's really poor for their outcomes. We're not addressing need at the right stage. So we end up in a position where we continue to see the movement towards crisis response, which is is already a real concern in terms of the amount of spend that's at the top end of the system on our statutory duties, particularly on children in care, but also on a range of other statutory duties. And that is at the expense of the sort of broader system-wide. And a lot of the recommendations from Stable Homes Built on Love, which talks about investment in family help and prevention. So, there is a strand, a core element of the National Reform Programme, which I think the whole sector agrees with and would get behind, but is potentially being undermined by the short-term financial challenges that authorities are facing.
If I may just add on that, I think the work that CCN did suggested that the sort of core statutory elements had gone up from 42% to 51% of spend over the second half of the last decade, and I think on the projections heading towards 60% over time. So there is undoubtedly, and clearly you can see an analogy between this and lots of policy areas where you find yourself on the treadmill, because those statutory areas, the more urgent areas, eat up an increasing portion of your resource, and it becomes ever harder to do the things that will actually help you out further down the line. So that I think again is a common experience of local authorities.
Okay, I will hand over to Nick Fletcher.
Thank you for joining us today. I believe all these costs are usually always down to supply and demand, the amount of children that need the places, the amount of places that you've actually got available to you. But what other significant factors are causing these high prices within children's homes? Where are the main costs? Yeah, that was you first.
So I think it's a combination of things that absolutely around that supply and demand. So we've got increasing numbers of children coming into the care system. And we have got some real challenges about how the system expands and provides the right sorts of care for those children when they come into the system. I think there's a lot of pointers around the fact that particularly the makeup of the residential sector at the moment and the increasing role and balance between private provision versus local authority provision, which is sort of 80-20 now, and particularly within that 80%, the increasing growth in a smaller number of larger, often private equity backed organisations that aren't supporting the growth in supply to meet need. And often it can be beneficial to their business models not to grow supply and to control supply in that way. So we have a couple of things that are operating in that space. You have a total number of beds available, which isn't growing at a pace it needs to meet demand. They are often in the wrong place. They're often not able to meet need. But also within that, you have a lot of those beds that are out of the system for different reasons. So homes that either for workforce reasons, regulatory reasons, or decisions made by businesses are not freeing up those beds to be used. That controls supply to a point which really drives up cost. And I think one of the points that came out strongly through some of the CCN work and also through some other work is looking at the transparency of costs and what you could perceive to be sort of surge costing type models and the impact of something that effectively isn't a market because the only purchasers of care are local authorities with public money, and the way in which that hasn't grown to meet need. I do also think there's a key factor around complexity here. So some of those really high cost placements that we've seen a substantial growth in, so more than 90% of councils now have at least one child whose placement cost is £10,000 a week or more. And the overall growth in those types of placements has been huge. The LGA report last year provided some real detail on that and the scale of that growth. I think the highest cost place was £67,000 a year, certainly in the 60,000s per week. And for a lot of those children, they are children who have a level of complexity, often with either significant mental health needs, have suffered severe trauma, or have substantial risk that is actually based outside of the home. So I think there is definitely a group of children for whom we don't have the type of provision available to meet need. Many of those children historically would have been in mental health inpatient beds, and the bed nights in children's mental health inpatient beds have reduced substantially without an alternative being put in place. So that's not to say that isn't a good thing from a policy perspective, because for a lot of children, mental health inpatient bed isn't the right place for them to be. But what's happened is that those bed nights have reduced without an alternative provision, community provision being put in place as an alternative. So those children are now coming into the social care system, and we have a model that's not able to meet their needs. Similarly with youth justice, where again it's been well documented and quite a positive thing that we have far less children going into youth justice facilities. But again, those children are now within the community and they're coming into a social care system where an alternative hasn't been found. And local authorities, through the Children Act, which is a fantastic piece of legislation, but was designed at a time when these young people were in different bits of the system and wasn't designed to meet their needs. Local authorities are now picking up that slack, and we really need a very different type of model that is able to fill some of those gaps, and I think that would address some of the really high cost placements, but ultimately there needs to be a complete rebalancing of the market model in residential care, much more sufficiency within local authority and not-for-profit provision, and a real growth around some of those things.
Yeah, I've got figures here for Doncaster, and I've mentioned them before in another select committee, but we've got one child here that actually attending mainstream school that's cost $677,000 for 1 year. So where would them costs have gone? And I mean, is the profiteering going off here? And I've heard that there's a child that's the first £1 million child as well. So it's not just Doncaster; it's obviously many other authorities. So where's the 670? Where's the £1 million coming from there? Because to attend mainstream school and still cost that amount of money, there's something not quite right here, and the taxpayer is paying huge sums of money out here. So I don't know if you want to answer that, Roger, or do you want to?
Can I, John, you may wish to come in with some other elements again, but let me sort of pick up on some of the things John was addressing and add a few points as well. I mean, firstly, just to go back, I think there is a fundamental issue of, if you like, misalignment of supply and demand, to partly answer your question. So big changes. Yes, the number of children in care has increased over the last decade or so by 20-odd%, something like that. But within that, there's been a big shift. So you see much more in the way of older children coming into care, and they are, many of them, as John was describing, those with the most complex needs. And I think a lot of that goes back to quite significant changes in terms of how risk is perceived for teenagers. It is to do with what's happened with level 4, tier 4 beds, with the youth justice system and so on, and I think all of those have contributed. There is, I know you've got somebody from the, a representative from Competition and Markets Authority in a little bit later in the morning, and they were clearly addressing to some extent some of the points you were describing. But as I say, we do undoubtedly have a market in which there is the scope for, surge pricing, if you like, some very, very severe needs as well, and those two things come together to generate very, very high placement costs. I mean, I think I'm not saying anything that's not been in the media when there was a case at a local authority which was costing, I think it was either £51,000 or £57,000 a week. In one. That was a very, very extreme case. But those are the sort of elements that you see. Now, clearly, there is, as the CMA report covers, there are elements of the market where there are clearly excess profits, or profits higher than you might expect, and they are not followed by investment in new capacity, which you would otherwise expect. If there were those levels of profits, you'd get further expansion of capacity and start to deal with the problem, and that is not happening.
Stuart, how significant are the activities of these private providers in generating these costs? Do you think they're playing with the market? What do you think they're... how do you think they're affecting it?
These aren't costs. Let's use the word, it's profit. That's what's driving this system. And frankly, at times it feels like bingo. We have to place children away from our local authority because that's the only available placement. The provider knows that there's no other available beds, so they can charge more or less what they like. Now, we try to manage that. We have framework contracts, the way we go about procuring provision, of course, but we are still left with a reactive system whereby a child might be discharged from hospital, still present a very high risk, and so we are then searching desperately for a bed. And this is replicated in local authorities up and down the country, day after day after day. I think there's a wider point. We sit here and we talk about cost and profit. These are the most vulnerable children in our society that we are collectively responsible for. And on a personal note, I don't agree with any profit associated with this at all. I'm not against commercialism because that can be very helpful, but we're talking about profiting from the most vulnerable children in our society. That, for me, is morally wrong.
I mean, businesses do have to make profit, otherwise they wouldn't go into business, would they? But the profiteering is that what you're against. Is that what you're saying there?
It is, although Scotland has a not-for-profits approach to its residential care, and I wonder whether there can be a move over time for the same in England, or that at least we would cap some of those profits so that it isn't actually exploiting children, because that's technically what's happening here. It's done through the lens of the local authority, but they're being seen as commodities. And I know that's a challenging statement, but it's the reality of what social workers and managers are dealing with on a day-to-day basis.
I think when you cap profits, you can create even further issues there. I think we have to be careful with that. I think we need to obviously always look at the supply and demand. I think that's the way that we work our way through this. I just want to go back to you, John, if I can. It says in your written evidence you highlight that specific legislative or regulatory changes have made it difficult for local authorities to plan for children's social care. Can you set out what these changes were?
So I think there's been a number of changes, not just within the legal and regulatory framework, but also in the broader framework. So there were some very specific legislative changes that have come in over the last couple of years in terms of supported accommodation particularly, and we're seeing a regulatory framework just coming in which whilst in terms of the principle of looking at driving up quality is absolutely the right thing to do in terms of cost and planning. That creates a lot of uncertainty in the system, and for I think it was CCN did some work with News in Europe which looked at potential rising costs of 15 to 30% as a result of that. So where those changes are made, we need them to be fully funded, and we need to be have recognition of the costs of a whole range of legislative changes that are there. I think there are quite significant regulatory challenges in this space as well. The Kerr standards are over 20 years old now. We talked a bit about the changing nature of the young people who we take into care, many of whom come into care as teenagers, often because of risk outside of the home, because of exploitation, missing, trafficking, a whole range of risks or complex mental health needs. And the way in which the residential standards are set up don't take that into account, because when they were established, it was that makes it very difficult for local authorities in terms of finding suitable provision on oversight of that provision, and how the regulatory framework enables us to meet our legal duties around some of the legislation that has changed in recent times.
So is there a risk that the bar is set so high that actually it's easier for a local authority to place children further away in an area where they have less direct responsibility for the standards of the accommodation than to develop the accommodation themselves?
I think the nature of the regulation has meant that we've got a real imbalance in terms of where most residential provision is. So we have a very property-based model, which means that particularly independent provision is very much concentrated in areas of low property prices, often areas of very high deprivation, which means that you get this really disproportionate impact in terms of local availability of places. It can also be really difficult for local authorities to grow their own capacity. So in Durham, we're at the moment trying to grow our residential capacity significantly. We were already quite a big residential provider by local authority perspectives, but within the sort of broader context of all the things you need to do to grow your residential capacity, that can be really challenging. I think ultimately the biggest issue with placements out of area is just a lack of sufficiency and a lack of choice. We're not making proactive, positive choices to place children far away from their own homes in the vast majority of cases. Very small number of cases where that would be the case, but in the vast majority of cases. But if sufficiency isn't there and the provision isn't available within our local communities where we want it to be, then we have no choice but to make decisions that we know are not what we would want to be doing.
Yeah, if I could just add on that, I think what we've seen, I'm going back to the point I mentioned earlier about a kind of mismatch between supply and demand. That's geographical as well as type, and for some of the reasons that John's described, you see growth in some forms of provision in areas of low property prices, of higher levels of deprivation. Again, if I may take my own example in Kent, coastal communities in Kent historically have had, and it's been a very long-running element to this, but there has been significant growth in that provision, and therefore very large numbers of other local authority children who are placed there, and that has an impact across the entire sector.
Yeah, so we've heard about the high cost of things. What impact are we noticing on the children and young people from the high costs? Can I start with Stuart first? Hi, Stuart. Nice to see you.
Yes. Hi. Likewise, the impact on the children, it comes back to two things really. It may be high cost, but it's not high quality in the vast majority of cases. Okay. So we are still then having to seek additional support from the NHS in terms of child and adolescent mental health services. We're still having to seek additional support in terms of learning. So whilst it may be a residential placement, it's very rarely the full package. And so the full range of the child's needs, which, as both colleagues have said, are increasingly complex, they're not being met. And often, if the child is then further away from the local authority, it's even more challenging to meet those needs because we're having to make contact with a range of agencies that we have no relationship with. So these should be seen as short-term stepping stone solutions, but often they're not because, of course, we can't find an alternative placement. So you get trapped into this cycle, and that's where there is an implication for the child's needs. They're not addressed and they're not met in the longer term. It becomes a holding position, unfortunately. Thank you.
And what measures are made then for out of placement? I mean, how do you work with other areas when you have to place them out of area?
Well, we have our virtual school head who will make contact with the education colleagues in the other local authority. We'll have key designated leads in the ICB who will do likewise. But these are children who are not the responsibility of that other local authority and those other agencies. And there you have that gap, because these are our children, these are Hampshire children, and if I'm placing them in another local authority, that responsibility rightly sits with me, not with those other agencies. So we have to corral those services, and that's challenging, very challenging.
And what impact in Durham and Kent then on children, A, being, the high cost and also being sent out of area?
I would absolutely support the statements Stuart made. We have real concerns about the quality of provision because quality doesn't match cost. Quite often, children will bounce around placements. Some of the external provider behaviour can be pretty appalling at times. So, examples of providers serving immediate notice or doing a range of things that are clearly not in the best interests of the child. So, really significant quality issues. Just the basic nature of a placement out of area, that means you're moving a child away from their friendship links, their community links, their family, their extended networks, as well as all of the things that they know. So, taking a child into the care system is a huge thing. It's a huge thing for that child. And if you then take them into the care system and then say, oh, okay, we're going to move you 100 miles to a place you've never been to, you don't know anybody, the impact for the child really, really significant in that way. So absolutely should be a stopgap where we need to, but we shouldn't be having to make these placements. We should be able to meet the needs of children within our own communities, and it's really important that as we take forward the reform programme from Stable Homes Built on Love, that is a real priority, that we're able to meet need much better. And as Stuart says, those links with other professionals, our direct oversight of the quality provision within the home, that all becomes much more challenging at distance than it does when it's a placement that's within our area.
And if I may just add, from our point of view, again, speaking here more from a Kent than a CCN perspective, we see this chiefly as a recipient. I mean, clearly we do place some children out of the county, although many of them relatively close by. So, for instance, there'll be some in Medway as our neighbouring unitary authority. But the biggest thing that we observe is the arrival of these children coming from, for instance, London boroughs or a number of other authorities, and that has all the impacts that I think both Stuart and John have already described. And it does, of course, also mean that we have a situation where many of our providers are then focused on that national out-of-area market, if you will, which, again, constrains then the placements that we can make locally.
And can I just ask, as a Kent one, I know you've come with another hat, but at Kent you've got the asylum-seeking children. What impact does that have on local provision for local children?
Well, it clearly is another source of pressure, particularly in certain areas of accommodation. We have, and there are a couple of elements. One is that there is a very specific issue we confront around reception capacity for those young people when they arrive. But equally, we will be, and have been historically, significantly above the recommended 0.1% level now. And that does mean pressure on areas, in some cases fostering, when you're looking at the under-16s, but also an awful lot in semi-independent accommodation. So again, it is another element in that equation.
Yeah, lots of pressure. John, you've criticised the government's intervention in children's social care and said that it will take several years before they're implemented. And I read a bit about what you'd said. What can the government do immediately to improve the situation on the ground, and what aspects of the strategy need further consideration?
So I think what we were saying is that we need that balance between long-term reform and change, but actually dealing with the immediate burning platform that we have here now. And I think particularly in the context of regional care collaboratives, and I know
we're coming on to that. My colleague's going to talk about that one. Yeah.
But actually, we need interventions that are going to address what is a completely failing market system at the moment for children's residential provision. We need to bring some rules and regulations to that. So whether that's a national set of interventions, ADCS published a paper last year of a range of national interventions we believe could be done in the short term that would enable us to start to address both some of the profiteering and some of the quality issues within the residential system. But also things like the pace and scale of change. So the investment in capital infrastructure, we know if we're going to rebalance children's residential provision, it's going to need really substantial capital investment in local authority and not-for-profit provision. There is a pot of funding there that has been allocated and some additional funding that came through in the spring budget. But the scale of it and the pace at which it's being rolled out to enable local authorities to expand their provision isn't quick enough. So it is very much about doing things much more at pace to be able to address some of those endemic issues that are there. And the other issue is around the funding. So if you look at the review findings, Josh McAllister's findings, where he talked about really significant investment, game-changing investment in family help to rebalance the system, that investment hasn't come through yet and is a discussion for the next spending review. But actually, by the time that comes into the system, we're another 3-4 years on, by which time all of these issues that we're currently seeing have escalated and we've not addressed some of those core elements. So it is about pace and scale of change, but also what can be done now.
I think there was some criticism about the pilot schemes too, that they're just, they will take too long to come through. I mean, do the others agree with that?
Yeah, I think it is all part of one argument, really, which is, as John mentioned, about pace and scale. So I think there is actually a fair degree of, not consensus on every point of detail, but broad agreement about direction of travel going back to the Josh McAllister review and then, the ambitions and overall direction of Stable Homes Built on Love. So I don't think there is vast disagreement about that. It is a question of how quickly you act on it, and the criticism in relation to the pilot schemes is actually there is already a fair amount of evidence, there is a fair amount of agreement, and this is to some extent stretching the process out, to a degree that whilst you can see why that might be understandable if you're trying to limit your initial spend, means that, as John said, the problems just mount in the meantime.
Yeah. Stuart, have you got anything to add on that?
I'd echo everything that's been said. I mean, in Hampshire, we're rolling out the new family help model next week, actually, because we recognise that there are benefits. We're doing it from a zero cost. There's no investment from the local authority in it, so it's hard to do, but we think it's the right thing and sets us up for the longer term. And John's absolutely right. We need some change now, but we need it from both ends. We need it, yes, in terms of the profit associated with the independent children's homes, but we also need investment in preventative services, so we tackle things from both ends. Otherwise, we are continually firefighting. There is no preventative budget that comes in. I have no budget in relation to that other than supporting families, which of course is very, very tightly focused and ring-fenced. And we need that investment. We've seen many third sector and voluntary organisations come out of working with children and families because they haven't had access to funding. So there's both ends that need to be challenged. Thank you.
Thank you, Robin.
Thank you. Bring in Andrew.
Thank you, Robin. And so I asked you all about this sort of regional care cooperative model that's being mooted, and I wondered whether you feel it would be effective in reducing local authority costs for children's social care, John.
Yeah, so I think ADCS is on record over extensively over the last 18 months around the regional care cooperative model. I think we see some significant challenges in the model as described in the care review, and that was taken forward into Stable Homes Built on Love. That isn't because we don't think that regional commissioning arrangements and regional arrangements aren't the right thing for some elements of the system. but what it has been proposed is a significant structural change to create a new regional entity that separates out decision making both from local democracy and from corporate parenting responsibilities at a local authority level. And it is that element of it that we were quite critical of. Both the time it would take to do that, because it would need legislative change, so you're potentially looking at 4 to 5 years at best of pretty challenging structural change and upheaval to get to a model where there's no real evidence that it's going to make any significant difference, when actually what we were saying is you can address a lot of those issues now. You don't need to create a new entity, you don't need structural change to do that. You know, we've seen challenges in other sectors, in the NHS, in probation, where focus on substantial structural change is actually taking us away from the core issue and the core element. So we looked at the RCC model and pulled out the bits that we think absolutely work and what should be done at a local level, what should be done at a regional level, and what should be done at a national level. So ADCS published a paper last year that did two things. It set out the set of national interventions that we believe are necessary to create the space for any commissioning model to operate and to work, because without putting those success criteria at a national level in place, it doesn't matter what commissioning model you've got, it isn't going to work. And then secondly, we defined what we think regional, national, local commissioning should look like, and how a significant part of the RCC proposal could be taken forward in an effective and workable way without moving to the full sort of purist model that was described in the review, which is the element we have significant concerns with. So we're certainly not saying that there isn't scope for much more change in this area, and there's definitely scope for local authorities both at local level and at regional and sub-regional level to commission more effectively. Our concern is this was almost seen as a silver bullet within the review, and ultimately this isn't a commissioning problem. So commissioning could be better, but unless you address the fundamentals that are wrong in the system, it doesn't matter how effective your commissioning is, it isn't going to have any material change in terms of the model. So it was looking, so fundamentally the RCC is a commissioning response to a problem that isn't fundamentally a commissioning problem, if that makes sense.
It does. Right, so Roger, do you see any benefits in a model that, to me at least, says that things would be better if there was less direct democratic oversight over them than there is at the moment, and that somehow a unit of 3 million or 4 million is automatically more efficient and better than a unit of 750,000 or 1.5 million?
Not put in those terms. I think where we've been in CCN is very similar to what John described in terms of the ADCS perspective on it. So we engaged a lot with the Kerr review, and in many ways very positively so. And I think there was a really, really good dialogue on that. I think, again, on the view about, if you like, aggregation of commissioning, the view we would have would be some and some. There are some merits, and I think it's worth remembering too, when you're looking at the 152 children's services local authorities that we have across the country, you are talking about radically different, radical differences in scale. And that will make a difference as to how you approach some of these issues. So there is a place, I think, for some of this, and you could recognise that it is part of the problem, part of the solution. There are a much bigger range of problems that we've described, and we'll to some extent touched on those already, may well come back to them. So I think it would be seeing it as simply one part of the solution, and taking. I also very much endorse what John just said about avoiding structural change. And to be fair, so far, what is being developed does seek to avoid that and seeks to take a more incremental approach to it.
Okay, thank you. Stuart, so similar question to you in terms of any potential benefit you can see versus what I think are the disbenefits of that lack of direct control. So Hampshire County Councils and their senior officers are part of some larger collective that is more remote, and this assumption that we sometimes get in social housing as well, which I also think is wrong, that somehow bigger units of operators of 40,000 houses will be more efficient and effective for their tenants than ones of 1,000 or 5,000. So I'm not selling it, as you can tell, but is there any actual benefit you could see in it?
From a Hampshire perspective, very little. It goes back to the question of our size and our own commissioning ability, so very little. There is, of course, always some merit in collaboration with other local authorities, but I see the real benefits in the RCC for smaller authorities. I just don't, I struggle to see it from a Hampshire perspective. Where I think there is benefits is in the national commissioning of the more specialist placements. So those, we talked at the beginning of the session about a reduction in Tier 4 psychiatric beds for children, a reduction in beds in the criminal justice service. On the face of it, all very positive. But of course, what we know is on any one given day, there are 50 local authorities chasing one secure welfare bed. So where do those other 49 children go? And the answer is into those really high cost, poor quality placements or bespoke packages, local authorities renting properties. National commissioning in terms of those placements would be a very sensible move, because whether the needs are psychiatric, safeguarding or criminal justice, those children are one and the same in our view. Thank you.
If there were national commissioning, though, who would be doing it? Would that be the MOJ and the Department of Health, respectively, in those categories? Or actually, is there a way of reconnecting that, I guess, with the local authorities?
I think
it would... Sorry, John.
No, go ahead, and I'll bring John in afterwards, if that's all right.
It needs to be cross-government. There are the Department for Education, Ministry of Justice, Department for Health, of course. And I do believe there may have been some early discussions that have started to take place in that area, but I'm not privy to it. John might be, actually, so I'll defer to him.
Thank you
on that.
Yes, absolutely. So there is a task and finish group that's been set up to look at exactly this issue nationally, which involves Department for Education, DHSC, NHS England, ADCS part of that discussion. I think it takes us very much into a space, whether it's at local, regional and national level, about an integrated commissioning model and how we take a coherent look across the system, so we don't come at this from a social care perspective or a mental health perspective or youth justice perspective. There needs to be a coherence to the plan. So whatever comes through that, we've been calling at either local authority or sub-regional level for a sort of better care fund type model that operates in adults to apply into children's services, and you could see quite easily how that type of arrangement could also operate at a national level with a cross-government plan with integrated resources that looked at how you map out something that comes from the starting point of a child's needs rather than which bit of the system you happen to be in. And I think that would be really important. I think at a local level that would make a massive difference, but you could absolutely see that operating at a national level.
Getting the scale right would be crucial, because certainly I recognise the picture, but when a local authority has one particular type of child or one particular type of need, but the costs can escalate enormously. I'll bring in Anna.
Thank you, Chair. Continuing with the theme of what can we do to improve the system, if I can come to you first, Roger, because in your evidence, you've stated that recent government measures tie the hands of local authorities and there's little to fetter the bad practices amongst providers. So can you expand a little more, please, on how local authorities' hands are being tied and what we should be doing to untie your hands and to give you the freedoms that you clearly would prefer to have?
Yeah, no, thank you. And in some ways, this refers back to a number of the points we've already been discussing, so just almost try and draw those together. So I think that was partly a reference to some of the regions, what we were just discussing, some of the regional models proposed. And I think underlying that was, in effect, the question of, is the problem that we see simply one of commissioning and the scale on which commissioning is carried out, or is there a more a wider range of factors underlying it? So our starting point was to say, certainly from a CCN point of view, we are not resistant to any sense of possible change, and in some places aggregation, we already said that, will vary a bit depending on the scale of the local authorities involved, etc., etc. But it is a mistake to see that as the root of the problem. And that's when it brings us back to the conversations we were having earlier about some of the distortions we're already seeing in the market. So, again, you'll have seen from the submission, some of the points on which we were seeking to focus was around some elements of price cap, and I take Mr. Fletcher's point that you can have perverse outcomes from that. But equally, and there may be room for a debate if you look back at the CMA report as to how they proposed dealing with some of the market distortions, and the answer may well be some and some as to how you best do that. But so whether you're looking at price capping and also within that then taking account of additional tiered extra needs that you would then seek equally to have a degree of regulation, certainly around what is basically surge pricing, and the points at which there is, extreme pricing in relation to excess, very specific demand, and back to that position of, a dozen authorities or several dozen authorities chasing one specific place. So it is those sort of areas. So I think we would see it as being looking at from both ends of the telescope. So recognising some of the issues around commissioning, but not fundamentally saying all the problems are around commissioning. And sorry if I may add another element to that, it goes back to some of the regulatory burden that then gets put on in relation to carrying out those activities. So there's been some reference already to the work that we did at CCN in relation to semi-independent placements. And whatever the merits of what is being put forward, the reality is that that is an extra regulatory burden, and the funding that is allocated to it, the estimates by CCN and Newton was that the incremental costs are probably 9 times that new burdens for funding. So it's all those things.
That would be another area you'd like to see looked at. Can I come on to the issue of reunification? Because we've heard evidence from the NSPCC and Action for Children in relation to their Home Again report. And they found that only 56% of 75 local authorities surveyed did not have a reunification policy or strategy. Do you think that that enough is currently being done? Are local authorities focusing enough on reunification with birth families? And do you think that that is a way of relieving the burden? And can you see any disadvantages of that policy as well?
I think not so much disadvantages but challenges. So I think it has some real benefits to be explored, but not a silver bullet. So if you and I think the work done by NSPCC and Action for Children was very, very good and important challenge to taking this issue into the debate. What I think we would say at the same time is there can be some real challenges in delivering this. So, a family's own circumstances may well have moved on. They may not be in a position where they are almost used now to sharing their lives with children. There may well be severe financial and other constraints on those families. It may well be their housing arrangements no longer are fit for the purpose of having, let us say, a teenager or older child coming back into their lives. So and there is undoubtedly a need, if you're going to take that forward, for having quite material support, certainly by the local authority in taking that forward. So all of those things are constraints. Now, I would hate to come out with that as simply a reason not to do it, and I think a greater degree of focus, bringing it up the scale in terms of the debate, is well worth doing, and that may well then flow through into some degree of national guidance and support, and looking at what the funding requirements would be. So I think it is a promising area to look at, but there are some quite significant real-world constraints as well in terms of what it can do.
Well, absolutely. I mean, I think there's 2 stages to this. There's the 44% of local authorities that currently don't have any focus on reunification, which presumably you'd like every local authority to at least be considering this as one of the tools in the toolbox. We heard that one council reported savings of £2 million a year by focusing on reunification practice. Have you got any experience of this in Kent? Has it worked in Kent successfully? What are the savings? And specifically, what are those long-term challenges? Because it's a worry. It could have worrying consequences.
It is something that we have certainly have pursued in Kent. Now, as I say, I think in doing so, we encounter quite often a number of the challenges that I've described. So I couldn't give you a figure immediately for what the savings associated with it would be at the level of our local authority. But it is, as I say, something which I believe, to go back to your first part of your question, is well worth seeing that local authorities collectively are able to give that somewhat greater focus to. But equally, I think it's something that in pursuing that, you would want to ensure that there was real account taken of the challenges around it and actually around delivering it. And as I say, I've put it more in terms of challenges than downsides, though clearly under some circumstances, and this would be a matter for the judgment in particular cases, if there remain those dysfunctions that there have been within a family, perhaps they may well indeed have got worse since the child was removed, then that clearly puts up a very, very large obstacle.
There'd have to be real safeguards in
Yes.
place. Thank you. Stuart, we've read your evidence about encouraging in-house provision. The obvious question is that given local authority budgets are so strained and under such pressure, how can the government generate more in-house provision?
If we take residential in the first instance, then clearly it's expensive to build children's homes. So capital investment would be necessary. Underpinning that, though, we struggle as local authorities with the revenue funding. And there needs to be a real drive around the care profession. And there's a proper conversation to be had about the care profession, actually. I think it came through in the pandemic, particularly with older people's homes. But do we really want to professionalise the care profession? Because it is amongst the lowest paid. And yet those staff, certainly in my homes in Hampshire, I'm asking them to care for some of the most complex children. So I think there's something about the professionalisation of the care sector that the government needs to focus on. It needs to be on a par with teaching and with nursing and with social work. And I think that would really give a lift to the sector. There needs to be a change to the regulations. John touched on this earlier, but I currently have 8 children's homes in Hampshire, with a 9th coming online. The 9th one is a dual building with health. We've gone into it together. Health have invested, the local authority have invested, recognising that those children's needs span both services. But the reality around the regulations are, in many of my homes, I have 4 beds, but often there's only 1 child in there, because Ofsted will come in and do an inspection and rightly say, this child is very high risk and has high complex needs. You should not place anybody else with that child. So they put a restriction on it. So my 1 bed that's costing me £4,000 a week is now costing me £16,000 a week, on a par, if not more, than some independent provision. And those regulations need to be changed. The phrase that I use a lot is, for children, life is a mainstream activity. It's not a solo occupation. And the pun is intended there, because children should not be isolated. They should be amongst their peers, should be, wherever possible, in a family type situation, however that might play out. But all of those things would improve in-house residential provision. And similar in a way for fostering. It's really interesting. In 22-23, Hampshire came out second across local authorities in terms of its increase in in-house foster carers. That grand total was 15, because we are seeing foster carers leave local authorities and the independent sector in their droves, a reflection largely due to the cost of living crisis, but also because of the increased complexity. If children's services across the country are getting better at supporting children to remain in their home where it's safe and appropriate to do so, those children that then do come into care will be the most complex. And we therefore need a sort of framework, I think a national framework around foster care that gives our foster carers the right skills and tools to be able to manage the changing needs of the children that we see.
Is there sufficient ongoing support, Stuart, for foster carers?
I have to say, in my contact with foster carers in Hampshire, they would say, yes, we've introduced something called our Hampshire Hives, which is like an extended family. So foster carers supporting foster carers with some professional oversight. So that means that, for example, if foster carers want to go out for dinner for the evening or go away for the weekend, They've got other foster carers they're linked in with that can provide support. And that peer-on-peer support is really, really proving valuable. And I think that's a model that should be replicated elsewhere. I know it is in many authorities.
Thank you, Stuart. I'm not ignoring you, John, but I'm passing over now to my colleague, Vicky.
Chair, sorry, apologies for being late, and I'm a new member of this committee, but I just have to make this comment. The fact that not a single opposition MP can be bothered to turn up at this session really does have to call into question how much they care about vulnerable children and the services we provide to them.
I think in the circumstances there
may be different
reasons why some members aren't here.
but I've seen it time and time again, very, very low attendance. A couple of members are great, but really what you're saying today, gentlemen, is really, really important. And the chances to change some of this. I was just gobsmacked by what Stuart's just said. £16,000 a week for one child. That's £832,000 a year. I mean, it's more expensive than the Hilton. Much. Let alone anywhere I've ever been able to afford to stay. And I'm just your recommendations on how to change that so we get better services for all are key. So, John, some have commented on maybe how we can get local authorities to work better with private providers to reduce some of these costs, to plan in advance so you're not trying to buy bed places at the last minute in a panic. How can we try and get better children's care service provisions by working together between providers and local authorities?
So I think there's lots of good examples of where local authorities are working really effectively with providers of all types, including private providers. I think where some of the business models operate, that is really difficult, and I do think we have to go back to what we want to see within the care system and the types of business models we accept. So there are some very high quality, mainly small private providers who have a lot to offer in this space. A lot of the larger providers who are driven often by private equity models mean that we have decision making that is about meeting debt requirements and managing the profits of shareholders rather than investing in the children in the system. And the only way we address that is by growing sufficiency in the bits of the system that are meeting need and that aren't undertaking some of that profiteering.
Is there collusion between providers that's driving up prices? Is there anti-competitive behaviour here?
I mean, the CMA model, the report was quite clear that this is not functioning as a market, and fundamentally, as I said earlier, that this is not a market. There is only one purchaser of care. We might be split into 152 different local authorities, but the taxpayer is the only purchaser of care. And what's happened is that because of the growth of some of these, I suppose, super providers with multiple arms, they have a scale that enables them to control supply and to have business models that don't grow supply, and that came through really clearly in terms of the CMA report.
So what would you like to see changed?
I think we need different investment models. We need growth in other bits of the system. So I would like to see substantial investment in growth within the local authority sector. I'd like to see not-for-profit providers being incentivised to come back in, and that could be by looking at social investment type models. It could be looking at a whole range of other investment type models, both to grow the overall sufficiency in terms of rebalancing that, but also to make sure that we then have an ability to match placements against need. So at the moment, particularly for those children with the most complex needs, we're not able to match placements against needs because they are not available. We will often have weeks and searches, national searches, for some children where we are not able to find any provision whatsoever. A lot of
government has invested some capital in some of these sort of specific areas. Is it just not enough?
It's not enough, and it's not growing quickly enough. So a lot of the investment and the investment that was announced in the spring budget is actually in expanding welfare, which is secure welfare type provision, which is really important because, as Stuart said earlier, you know, there are 50 authorities looking for any one secure welfare placement at any time. So a significant amount of the investment is going into that area, but it is about the scale of that investment, and ultimately whether that's through government capital funding or whether that's just through looking at very different investment models that enable us to grow at pace.
We're sort of running out of time. Does any local authority do this really well to sort of advance purchase in their area, you know, support social providers, like you've said?
So there are models of that type across the country. There are sub-regional sufficiency type approaches. There are procurement models. So we nearly all have models whereby we have sort of framework type arrangements where we engage with providers and look at a whole range of framework conditions, including price and quality. Certainly within Greater Manchester and within London, there are some models at quite a lot of scale in terms of those sort of sub-regional type arrangements, but they will still only ever have a minimal impact because the material elements of the system are failing, and unless we address those, all of the best efforts of local authorities working collaboratively, working more effectively around commissioning, linking in with providers of all types to grow their capacity, that will only be able to take us so far. We need fundamental change at a national level in terms of the type of system we want and the models that underpin that.
And really quickly, if I may, Roger, you spoke to Flick briefly about the You Ask children and the impact that puts on local children. I recall when we used to speak before, the issue of age verification being a big extra hold up in the system, how long that took and how uncertain. Is that age verification system any better? Is there more that we could recommend in this committee to address that?
Well, some of the work on that has been taken forward. I think it would be good for the committee to encourage that work to continue. I think that
like medical age verification measures.
Yes. I mean, there is that. None. Again, to come back to an earlier phrase, none of these things is a silver bullet because we know that it can assist what is otherwise sort of contextual work in assessing it. Where age verification has often come to be an issue, of course, has been in or age disputes. Has been as asylum seekers, not necessarily initially considered as children, are placed elsewhere, and then there is a dispute over age, and that's often become a big issue for those hosting local authorities.
That puts an extra burden on the services as well.
Indeed. Okay. If I may just briefly touch on the points that you raised, clearly, as I say, I know your next session has a representative from the CMA, but one of the points made in answer to your question about excess profits and so on was what certainly seemed to be the case, as I may have mentioned earlier on, is that you did not get that investment in new capacity that you would expect from the level of profit made, and that does suggest some flaw in the market. There are also a number of points in terms of approaches to these to commissioning. There's some work that we did at CCN on what I believe is called valuing care, which is seeking to do a proper assessment of particular forms of need and pricing and commissioning those accordingly, which again I would commend.
Thank you. I will bring this session to a close. We can go on to the next panel. I'm very grateful for all your input and it will be useful for the committee. Thank you.
The proceeding is currently suspended. 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 The proceeding is currently suspended.
I have Dan Turnbull, the Senior Director for Markets, the Competition and Markets Authority, Andrew Isaac, Chair of Children's Services Development Group, Dr. Mark Kerr, Interim Chief Executive Officer at the Children's Homes Association, joining us online, and Lucy Croxton, Policy, Public Affairs and Campaigns Manager at the Together Trust. You're all very welcome. Can I put my first question to Dan? You've heard, I think, some of the previous panel's conversation about the regional cooperative commissioning model that your organisation has recommended, and some organisations and providers have said that pre-existing regional commissioning arrangements should be prioritised rather than making structural changes. Some charities have said that children might be moved to cheaper areas of a region as a result of the proposed changes. How do you respond to those concerns about the regional commissioning model?
Thank you. So our recommendation was that certain aspects of commissioning need to take place at a higher geographical level than is currently the case, simply because local authorities are on average operating at too small a scale to effectively engage with the market. So the majority of placements we know are spot purchased in the market, and when that situation is happening, local authorities are in effect distressed purchasers. We know that they have to make a purchase. They can't delay making that purchase, and they're purchasing in a market where there is insufficient appropriate supply for them to do that. So it's almost inevitable in that situation that they're going to be pushed into making suboptimal purchases that don't necessarily meet the needs of the children, and they're going to be paying high prices for that. So in order to increase the power of those local authorities when they engage with that market, it's important to move away from that distress situation to a more controlled situation where they're using things like block contracts, advance purchase, to be able to shape the market so that that supply is there when they need to call on it. As I say, our concern is that the number of placements that individual local authorities are purchasing, particularly in that very high needs segment, is too small and too uncertain for them to be able to do that effectively. And we think that can only be done at a higher geographical level. Now, it's important to say that, Chair, that our recommendation wasn't for any specific model here. And we said that we weren't the right people to say which types of activity need to take place at that level or what the appropriate geographical level was, but we were very clear that local authorities will continue to struggle in this market operating at the current scale.
Okay, that's a helpful clarification. Can I just ask, did you, in informing that work, did you look at the relative performance and the relative challenges faced by larger upper-tier local authorities and smaller ones, and perceive that larger ones were doing this more effectively with fewer of those cost pressures, or is it more theoretical than that?
No, we did, and it was clear to us, as you say, Chair, that some of the larger local authorities were dealing with this more effectively because of that greater scale.
I think we've heard that every local authority faces those challenges, particularly at the acute end, and I guess what we just heard in the last session was a suggestion that actually national commissioning in some of the most acute services, particularly those related to criminal justice and mental health, might be more appropriate than a regional approach. I have to say, I also sit in a county perhaps which is uncomfortable with its position in a region sometimes, and feel that regional boundaries can sometimes be much more artificial to the people who live within them than local authority boundaries are. Do you recognise those challenges with any regionalised approach?
We absolutely do, and I would completely agree with the notion that national commissioning may be the most appropriate approach for some of those extremely high need cases.
That's interesting. I'll bring in Flick.
Thank you very much. I'm just looking at the role of residential care and whether it be in the landscape of the whole social care system. And is the balance between the different, so the private, in-house and non-profit provision, is that in alignment? I think. I've seen something like there's 77% are in the private sector, 17% run by the local authorities, and the other 5 are by the voluntary sector. That was 2021. So is that balance correct? And what role is there for the residential homes? Can I start with Mark first, please?
Hello there. Well, the Children's Association represents all sector, local authority, charities, and the independent. And I think it's a choice. We have to recognise that the current makeup of residential across the country is kind of a consequence of the late 80s, early 90s, that local authorities and charities withdrawing from that sector. There was a void that was filled, and it's been a long evolution since the purchaser-provider split from the 1991 kind of Health and Social Care Act. We do believe that there needs to be some rebalancing at the Children's Home Association on this, but we kind of, whilst hearing the rhetoric at the moment around providers, particularly the private one, has become very toxic. There are committed practitioners across the country that are constantly kind of basically told that they are profiteering. They hear that loud and clear. But for the people on the ground, that's not necessarily true. And Dan himself will acknowledge that they only looked at the largest providers. So in terms of the split, I think that's a decision for local authorities. But local authorities always have a choice to open up provision themselves. And if they have an issue with the current market mix, then there's a straightforward solution that they need to open up more provision themselves. But the current kind of toxicity really doesn't help the sector or the children in it at the moment.
Okay, Andrew.
Yeah, I'd agree with Mark certainly on you're correct on your breakdown of the market. What has particularly worried me, going back even 10 years, 50% of the homes were owned by the local authorities. It's now a very small proportion. My understanding is there's only actually a very small number of homes run by the children's services functions. Now, what's transpired from that is the intellectual property and the experience has moved from the local authorities into the independent sector. The independent sector now carries the intellectual property of long-standing employees over a 20-year period. Now, in order to solve that, there's got to be a lot of interface between the independent sector and local authorities on how we solve it. And if I may just bring in a little bit about the regional commissioning there, from what Dan's perspective is, regional commissioning will help professionalise commissioning. At the moment, you're dealing with 152 different local authorities. Some of them are in framework agreements, etc. But this would allow all providers, and then you'd have local authority provider, independent provider, voluntary provider, and specialist providers in a region, and we shift the focus onto what's needed for the child. It should be a child-centric system, because if you start looking at what's happened over the last number of years, and if I could divert just a little bit, 1,500 Sure Start centres have closed. As a result, in the last 5, 6 years, there's been a 67% increase in 16-year-olds coming into care. And what can you do with a 16-year-old between 16 and 18, and we transition them into adulthood? And one fact to add on to that, the prison population, 24% of the prison population have been through the care system. If you did the maths on that, that's over £750 million, that cost. Now, surely we could manage something to bring that back into the younger people to make sure they can transition into adulthood. So, whilst the whole system is very complex, I totally agree with you that we should have, one, a regional commissioning that works and based on professionalism, and two, there should be a much more dialogue. DFE carries so many stats, it's unbelievable. I'm not so sure all the dots are joined up.
Okay, Lucy.
Yeah. I think what's important about the mixed economy is that it works for the children that need somewhere to live and they need a high quality home. We don't know enough at a national level about whether children are living in homes that are actually assessed as being in their best interest by a social worker. And so it's actually quite hard, I think, to evaluate whether the market is delivering good outcomes for children when we know very little about what it is actually that children are needing from their care fundamentally. as a provider of children's social care that's been running in Manchester and surrounding areas for the last 150 years, the average length of service for our nominated managers of our children's homes is over 10 years, and there is a wealth of experience and knowledge that comes with that. Now only 3% of providers of residential care are actually charitable providers, and so there's something to be said also about collaborating together, which we're trying to do in the Greater Manchester area by bringing together 6 different charitable providers that share our ethos and our commitment to high quality residential care, and actually seeing how we can collaborate both in terms of tendering opportunities but also in terms of sharing best practice and actually keeping that part of the sector alive.
And do you think that will have an immediate impact? How can we improve it quickly?
I think there's a few things that we can do. I think we always need to go back to the fact that children need a voice in the home that they live in, but also in the broader system. So at a national level, we have been calling for a long time for the United Nations Convention on the Rights of the Child to be incorporated. This would provide children at a national level with a mechanism for having their say on policy that affects their daily lives. So when the government is making policy around residential care, whether profit should be phased out, for example, children would at least have a seat in the room to be able to share their views, but we don't feel that that's happening. In terms of local practices, we feel that there's more collaboration that the charity sector can do, certainly. And I think one of the risks with a move to regionalisation is that actually providers that are able to benefit from an economy of scale and have a broader geographical spread might actually push smaller providers out the market. And that is a problem if those providers provide high quality care for children in their area.
Yeah, we heard earlier about, that you weren't, I don't think, in the room, but that the local authorities would rather it nationally rather than regional, I think. Daniel, have you got any more to add to that about the balance in particular, which you found in your findings?
It was clear to us that, as I said earlier, you have this situation where local authorities are too often in a forced purchaser or distressed purchaser situation. And to improve things, you need to reduce the occurrence of that. One way of doing that, of course, is for them to have more of their own resources in terms of their own homes that they can place children in. And that's an option. But that goes out with the CMA's responsibility to say that, we can't say that there should be capital funding available to make that possible and so on, or to dictate to local authorities what their policy should be. So we concentrated in our report on, given the extent to which local authorities are currently engaging with the market, how can we improve that? But I very much acknowledge that that other option is available. The other point I'd pick up on, which Ms Croxton just spoke about, and I absolutely agree with, is the difficulty of knowing how often local authorities are making suboptimal placements because they're forced into it by lack of availability in the market. And we found getting information on that very difficult in our study. So just to take the example of out-of-area placements, we were told by local authorities that sometimes it's important to place children out of area to move them from gang influences and so on. What we couldn't find was, well, what proportion of out-of-area placements does that make up? That simply isn't recorded as far as we could see in any way. When it comes to particular support needs for children being available or not available, it's even more difficult to understand that that's there. And usually when a market's working effectively, if the product being offered doesn't meet your needs, you don't purchase it. And the suppliers therefore adapt their offering to meet your needs, to try and make you buy it. In this case, local authorities have no choice but to purchase something, and we don't even know when what they're purchasing isn't meeting the needs.
Can I ask, as part of that, did you look at how often placements break down in those out-of-area placements? Because I think one thing I was struck in conversation with my own local authority is they were talking about massive increase in costs every time a placement broke down, because that child then becomes perceived as high risk, becomes harder to place, and those elements. Is that part of the structural challenge at the moment?
It wasn't something that we looked at quantitatively as part of our study, but we did hear evidence that that placements were more likely to break down in that case. Similarly, when placements are made and the right level of support isn't there, placements are more likely to break down. And, as you say, Chair, that's worse for the children involved and can be more expensive for the local authorities.
And is there any difference between the different types of provision, local authority versus private versus voluntary sector, in terms of the stability of placements? After all, the government strategy is headlined stable homes. Have you looked at the difference in stability across those different systems?
We didn't look at that in a quantitative sense.
Any views on that, Andrew or Lacey? Or Mark?
I think from my perspective, you have to take what is right for the child. And in some instances, take London, for example, there was around 400,000 children that are involved in the gang side of things. Now, would it be right then to move them out of area to be away from that? But on the other hand, if you're moving someone too far away, then you run the risk of abscondment. So it's a very delicate balance, and that is we should not be looking at a child as a commodity. We should be looking at the individual needs of that particular child. And I just had a quick look at the number of children being placed out of area since 2019 has gone up 13%. Now, realistically, if you're a small, condensed local authority in a metropolitan area, you're not necessarily going to have the provision that you need within your boundaries. If you're looking at a regional area, you will be able to see what specialisms there are within an acceptable distance of where you need that child to be. And I think there was a question in the previous section about reintroducing families back together again. Because if you fix it in the first place, then we would not be here today, I don't think, on that. And I think that's the geographical limit that has to be applied per individual child. But it's having a sufficiency and a capacity in a reasonable area. And I do, the more I think about it, the more a regional view, if you take special needs education, is very difficult to keep that within the confines of a geographical area. A larger area would give you access to more needs, whether it be disability needs or sensory needs.
I see Mark's hand up, and then Lucy, I'll come to you as well. Mark.
Thank you. Just going back on a couple of the points. I mean, at a regional level, we agree, and in the previous panel, it was highlighted that I think at the higher end of acuity of need and risk, that there is definitely opportunities to commission placements at a regional level. I think in terms of the lower need, your day-to-day placements, they need to be at a local authority level. And often some of the figures that have been cited around these high costs, they are at the higher acuity end. And that is where some local authorities do really struggle. And your point about children being placed out of area, how many are placed out of area that don't need to be? Yeah, that's a really interesting question, and something that I've got on my kind of agenda to have a conversation with the DFB about in terms of data items. So, for example, we introduced a data item a few years ago around children that are placed, siblings, for example, that are not placed together, where the care plan was for them to be placed together. Very simple statistical collection, and actually what we found there is that actually increased significantly, which is to the detriment of those siblings. We could introduce a data item that said, is a child placed out of area? Is this in line with the care plan? So, for example, some that maybe it's subject to exploitation, county lines, offending, that we do need to place out of area for their safety. It was just highlighted that since 2019, the numbers have gone up by around 13%. But if we look at the journey from 2019 to now, and remember my previous visit to the committee around county lines, exploitation, well, we've seen a greater recognition of that in recent years. So there's potentially a large number that are placed out of area based on their needs and risk profile.
But at the moment we don't know. And I think to Daniel's point, there doesn't seem to be a tag in the system that identifies that. So that certainly seems to be something that we could ask DFE to look into. Yes. Thank you.
Yes,
Lucy.
that's a simple solution.
I agree completely. I think there's an absence of knowledge in the system about whether children are living out of area because it is in their best interest or not. A few things I wanted to flag. There is a big difference across the country in terms of the actual provision available to children. So obviously in the northwest, you may have heard already, there is more residential care than in other parts of the country. We've been in that community for 150 years, as I say, and so all of the children that are in our homes come from the relevant local authority. However, that is increasingly rare. And I think one of the problems underpinning this is the fact that now you have two ways essentially to buy a place in a children's home. The first is through a commissioning framework and the second is through spot purchasing. With 97% of placements bought through spot purchasing, what that actually means is that local authorities are on the back foot in terms of trying to find a suitable home for a child, often in times of an emergency. Whereas with a commissioning framework, that means that the local authority knows that they do have a certain capacity of homes in the area. We are in the commissioning framework, but we think that there is a perverse incentive for providers to actually not join.
Being in that.
Exactly.
And Andrew, I mean, you mentioned the professionalisation of commissioning in that respect. Yes. Would that see a higher proportion being off the spot market?
I think so, because one you're dealing with the outcome for the child, which is that's where exactly where we want to be. But secondly, and a point was made in the previous session regarding the regulations and the difficulty of placing additional children in a 3 or 4 bedded home. Now, I think if that's reviewed and that's taken into account, then you'll have less pushback.
I mean, that example that was given, I thought, was quite shocking in a sense,
yes.
in that clearly to have one child in a home designed for 4 children and then to have other children having to be placed further away as a result seems massively counterproductive to the well-being and welfare of those children.
It's a pretty reasonable assumption in my view across England. And just to give you another example, there was a question regarding the larger costs. If you have a single child that requires 2 or 3 adults per child 24/7, that's equivalent of 23 to 25 full-time equivalents. It doesn't take much maths to work out how much that's going to cost without any therapies that sit around that. And so I think in terms of that professionalisation would identify where these children could go.
Thank you. I've abused my chair's privilege, so I'm going to hand over to Nick now.
This is a question for Dan. Your organisation's 2022 market study criticised the materially high profits within the children's social care sector. I don't believe in doing this, but what are your thoughts on limiting profits and prices? I think every time we mess with the market as a government or as legislators, we can have huge issues within that. But what are your thoughts on it?
Well, thank you. I mean, in this case, there were 2 considerations that we took into account in thinking about this, and we had many representations from different organisations saying that is exactly the route that we should take. We decided not to go down that route. Firstly, there's a practical consideration in this market. What is being bought in terms of the placements are quite bespoke, can be quite bespoke to the children, and therefore you need to have a really good sense of, well, what is the kind of banding of the level of need that is being purchased, so that you can say what is an appropriate price for that. In our view, that level of detail and understanding doesn't exist at the moment that would allow anyone to appropriately set prices. But at a bigger level, our sort of greater concern in this area is that usually when you see high profits and high prices, that's a signal for more supply to come into the market and expand supply. But that's not what we're seeing here. We're seeing an undersupply of appropriate placements in the market, as we've heard from multiple witnesses. When we look at the investment that is taking place, expanding supply in this market, agree it's not enough to keep up with the demand that is there, but the net increase in supply that we saw over the 5 years we looked at entirely came from private providers. Local authorities actually have reduced their supply over that period, and not-for-profit providers were more or less stable. So we'd have a real concern that any attempt to cap prices could have a really negative impact on the supply that we see here, and therefore the ability of local authorities to find appropriate placements for their children at any price.
So why do you think you're not getting that interest in the market? Because obviously the money talks, doesn't it? And obviously the more people come in, then obviously, I mean, that's the way you actually really reduce prices. You either decrease demand, or we're putting more care homes, don't we? That's really the real way of doing it. So why do you think we're not getting that interest there from the market?
So I think there's both a short-term and a long-term answer. So in the short term, as demand for placements goes up, there are rigidities in the market which mean that it can't adapt very quickly to provide new placements. So it takes time to get through the regulatory requirements that are rightly in place to protect children, but those do take time to get through. It takes time to find suitable properties, get through the planning system, find staff, train staff, and so on. So the market isn't initially very responsive to that. In the longer term, I think there's more of a structural problem in that if you want to have local placements available at short notice, that means that you have to have some slack in the system. You have to have some empty placements that are available for children to move into in all areas across the country. But where providers are surviving basically by providing the spot purchase market, there's no incentive for them to have any excess capacity open. They're only paid when they have children in those beds. So in order to get to a situation where you're working with private providers to provide that excess capacity, you have to have much more long-term commissioning agreements based on block contracts or similar processes that would incentivise them to provide that capacity and crucially keep it available in each local area.
I think you looked as though you wanted to come in there, Lucy.
Yes,
please.
Just
please
briefly.
do.
I think Mark's got his hand up as well.
All right.
Many providers that we've spoken to have been actually put off in terms of investing in the market within the last 24 months or so because of rising interest rates. And the impact that this has had is that a lot of providers rely on borrowing in order to open new homes, and so have taken a cautious financial outlook about opening new homes. And so I think that this is a potential reason why the market slowed slightly. The other thing is that staff costs are by and far the biggest overhead for any provider, and increases to the real living wage, which we pay and have paid for a number of years, mean that actually it's now a greater proportion of our total overhead, which we feel is right to do. Our staff work day in, day out with the children in our care, but that is some of the challenges I think that providers are facing, which is actually increasing the cost of care in the market.
Out of interest, are you able to tell us what proportion of your costs are staff costs as a not-for-profit company?
80% of our overheads are staff costs.
Which is a similar level to what we see in the school sector. I know that the department recently changed its guidance to raise it from I think 76% to 82%. But is that a similar level in the private sector providers, or
it would be broadly the same, yes.
Yeah, so it is high. When it comes to excessive profiteering, we believe that excessive profiteering is damaging the relationship primarily between commissioners and providers, because what it's doing is that it's breaking down the relational style of commissioning which is needed to find the best quality home for a child when they need one. So we think excessive profiteering is a problem, but profiteering in of itself is almost a prerequisite because it's holding the children's social care system together.
The profit motive, perhaps, as opposed to profiteering.
Yeah,
no,
sorry,
indeed.
rather.
Yeah. No, understood.
Mark?
Yes. Well, I'm just going to kind of go through some of the cost elements. It's probably the most frequent long-scale conversations that I have with civil servants when we meet probably on a fortnightly basis. In terms of the cost going up significantly over the recent years, there are so many factors there, from inflation, as Lucy highlighted, borrowing costs, the inflationary pressure on wages. And I just want to flag that as a really important one because it's going to increase. And the reasons that it's going to increase is whilst we absolutely welcome more local authorities opening up children's homes, the remuneration packages by local authorities are higher than the private sector. We have to acknowledge that. And the Personal Social Services Research Unit, my old department, the University of Kent, have over many years published the unit costs of social care and evidence that actually the independent sector is generally around about 15% less cost than local authority provided care. And my analysis kind of is drilling down into that, indicates that that's generally around the remuneration. So what we're going to see is, as more local authorities open up homes, we're going to see the wage inflation that the private sector is then going to have to catch up with what is a very finite kind of pool of practitioners, because we need experienced practitioners. But in terms of why are we not, and it's quite rightly highlighted in a business area that is commercial, why are we not responding and open up more placements? Well, one of the critical issues is that if we look at workforce, it's been one of the biggest areas that we've got no movement from the Department of Education on in terms of supporting recruitment, workforce development. And to give an example, there's one statutory post, well, there's two statutory posts in a children's home, but the key one, the registered manager, at the moment, between 10 and 15% of children's homes do not have a registered manager, so they're operating outside of regulations. We have a massive blockage in getting good quality residential managers. They're now able to command a salary of between £50,000 and £70,000 due to supply and demand again. But in terms of that's a barrier. You have to have a registered manager to open up a children's home. And the other most significant one, which is one for your colleagues in DLUC, is planning. Some of our most kind of high quality providers is taking up to 12 to 18 months to get planning permission. So if you combine the high interest rates, the shortage of registered managers, problems with planning permission, and I will say the overall toxicity towards private providers at the moment, that makes a heady brew, and is the cumulative effect is nobody wants to open up more provision. And it's not about trying to control market and supply and stifle supply. It's a multitude of barriers that are currently not being resolved, and it feels like we're in a political policy limbo at the moment until the election. So we are storing up problems unless we take some immediate action on those areas.
The Welsh Government announced their intention to eliminate private profit from the residential and foster care system. What are your thoughts on that and the risk that could occur?
I've been through over 2 years of pain on working groups. We're hoping to get an announcement soon. Obviously, there's been a change in First Minister there. What I can say is that there is no plan. There was an assumption that all the providers were going to just convert to being a not-for-profit. None of them are. And the government doesn't really have a plan of how they're going to do that. It's going to cost them several £100 million that they don't have. What we're really talking about is a nationalisation exercise. But there is no plan. The providers have all stated they're not going to turn to being a not-for-profit provision. They're also not going to sell their provision. They're just going to repurpose it, because they've got two policies in Wales. They've got the rebalancing social value in social care, which we fully support, and then they've got the eliminate, and they don't work together. But the rebalancing one is absolutely right. And whilst there is the Children's Home Association just finished a kind of a real hard look at this, and I've been able to see the Scottish situation, having done a year secondment there in the Scottish Government, and the situation with Wales, and trying to find the solution. And we recognise there's a need for rebalancing, and there's an obsession with profit, but the missing thing is debt also. We've had to acknowledge that the Children's Home Association, that high interest rate debt between tax haven countries and the UK is probably one of the biggest issues that we do need to tackle. It's not necessarily about profit. So it's really complex, and I think as long as people kind of are prepared to have the uncomfortable conversations around what the problems are, what the barriers are, we can move forwards. But the longer it takes to move forwards, Wales doesn't have a solution. Scotland doesn't have a solution, and we can't just import these situations to England. Otherwise, you're going to have a multi-billion-pound nationalisation exercise. It's just not feasible, and we don't expect it to happen in Wales either.
Thank you for that, Chair.
Okay. Vicky?
So is the issue profiteering, or is it that there's such high barriers to entry and so many challenges to opening new homes, you can't get enough new homes open to have a market where the prices are reasonable? Lucy?
Good question. In terms of the barriers, the regulatory barriers, we believe that the barriers are quite rightfully high. Caring for children is a specialism and it's a vocation, and it actually requires...
You have no problem with the very high profits then?
In terms of excessive profits, I feel I've already stated that we think that this is actually breaking down relationships between commissioners and providers, and we do not endorse excess profiteering at all. But when it comes to the regulatory barriers, what we're concerned about is the fact that in semi-independent accommodation, there's been a 210% increase in the use of semi-independent accommodation in the last 10 years or so. And what that's indicative of for us is the fact that the barriers to enter that market are far, far lower than the barriers to enter the residential children's social care market. And so investors are looking at that market as a better alternative in terms of setting up a business. Now, there's no relationship there between the quality of care that is provided in those places with the actual attractiveness of the market. So I believe we need to refocus back on what the best home is for children that need it. It might be foster care, but there's a shortage of 8,000 foster carers in the UK, and therefore residential care is the best, safest option, I think, for children as an alternative.
But can I just follow up on that, Ricky? Because your point really around the regulations, barriers to entry, you're both saying you support high standards of regulation, because quite rightly this is very important for protecting the children, but you also seem to be saying that is creating a perverse incentive for people to avoid the regulation by putting people into semi-independent living. I mean, isn't there an argument that therefore if the standards of regulation were not quite so high, that perverse incentive might be removed?
What we believe is needed is investment from both private sector, local government and voluntary sector. It does need looking at in terms of what are the barriers to the market, but the CMA also identified some of those things, and actually I don't think that means that we should compromise the quality of care that children are receiving in this country, because the whole market is built around those children to get the best outcomes for those children.
Obviously you want to get children to have excellent care.
Yeah.
But obviously you're also concerned about the very high prices, and you said that you think that if there is excessive profit being taken, that's breaking down the relationships within the market between the local authority and affecting the children. So you can't have it both ways, to say, I'm going to make it so difficult to open a new home that nobody else can open a new home, and then say, but I'm not prepared to pay the price that
we're a provider, so there has been a growth in terms of the residential care market over the last decade. That growth hasn't been exponential, but there has been a growth year on year. So more people are coming to the market and opening residential children's homes. However, interest rates and other factors that I've previously mentioned have had an impact on people's attitudes towards opening homes, and so we need to see how that works long term and whether that changes providers' minds.
So, Mark, do you think there's an issue with profiteering, or do you think there's an issue with barriers, or do you think there's an issue with both?
I think there's an issue with both. Obviously, we have very clear values that the Children's Home Association would never support profiteering. We don't know the level of it either. It's really difficult, and I don't envy Dan and the CMA's work in this, but we've looked at the very top providers. We do not believe they're representative. I mean, we do a kind of annual state of the sector survey, and certainly for much smaller providers, the profit levels that are cited for the larger ones, it's a very different model, different business structure. They're very much in single digit. There's economies of scale, of course. It's a bit, if you were to compare Tesco's operating costs versus the small kind of deli corner shops, etc. They're operating to very different models. And the same as the internationally funded ones are also operating to different models. So it's complex. But I'd agree with Lucy that we do need a decent benchmark in terms of to open provision. If you are to look at the total cost, so for example, we do this work a lot to open, say, a 4-bed children's home, you're probably going to need access to around £750,000 to £1 million of capital, either through financing or through loans or through mortgages. You're probably going to have a deficit in your first year of about £200,000 whilst you bring children in and staff, etc. So that's where some of the new providers it goes very wrong for. But in terms of the point around, there is now a perverse incentive for local authorities financially to move kids into semi-independent too soon. So we do need to potentially make it easier for some providers to open up quicker, and we're working with Ofsted on this. So if you have a long track history of operating outstanding homes and a track record, maybe there's a fast track way of being able to register provision there. Whereas if you're brand new to the sector, maybe maybe the route is a little bit more thorough to ensure that you are the right person to look after our most vulnerable children. And there's a similar argument for planning. We need to come up with an arrangement with the planning, with DLUP, to say that if a local authority director of children's services and the commissioner say,
I'm going to have to stop
yes,
you because I want the last word on profiteering to go to Andrew. Is there an issue with profiteering? Is the issue with barriers?
And I think if you look at the social care market in terms of children, it's been a mixed economy market for nearly 3 decades. The rhetoric of the last few years has been very damaging from the relationship between the independent sector and the local authority sector. In other words, the structure of moving forward needs to be a lot more collaboration in making sure there is sufficiency within there, but also to put it into context. In terms of the 80,000 children in care, over 80% of them are actually in foster homes. And that is, the barriers to entry there would be regulatory and statutory as opposed to capital intensive, is the recruitment of foster carers is really significant. Everybody is fishing in a pond that's nearly empty.
The needs they're being asked to meet are more complex than perhaps they sometimes.
And children are a lot more complex. You got. It's different having a 5-year-old come in where the attachment can be fixed to a 16 coming in with mental health issues and challenging behavioural issues.
Yeah.
That is putting people off, but there is stuff the government can do within foster care that will make a difference. At the moment, is giving extra leave, a few other tax benefits that could be put into the system to encourage people to come forward. They are terrified of allegations, and that puts an awful lot of people off. Again, there is some work being done by the DFE in terms of foster care recruitment with a group of local authorities, but the collaboration isn't there. It's closed door to some of the external companies who have.
Thank you. I need to hand over for the next question.
I'm going to hand over to Andrew and come back on.
Okay. Well, we touched on some of this already, so just want some sort of additional comments if people have them in terms of whether you feel that there is either a positive, a negative or no relationship between for-profit ownership of children's service providers in terms of the care that's provided, and does a preponderance of for-profit ownership within any particular area lead to an increase in out-of-area placements, or is that not a correlation either, Andrew?
I don't think it's a connotation. I think in terms of you must remember that the effectiveness of running a business is important. So I think the management effectiveness, the experience that people now have, often means, because they're focusing on just fostering or residential, the management team is focusing on a much narrower band of need than perhaps a local authority that has responsibility for a wide range of issues in family care. So that would be a reason why collaboration and working together on that would drive that forward. So the independent sector is willing to invest. The independent sector has lots of experience. But I'd also add that in running any business this day and age, what you might have done 30 years ago in going to your bank for a loan has been replaced by myriad opportunities with other organisations. And I think the rhetoric over the last few years has been damaging to the children's sector in general. And I think it's about time that stopped, and we actually got together and said, structurally there are things that can be done. Where is the low-hanging fruit that can affect? One of you made a point on it in terms of the pilot testing that's going on at the moment. Now, by the time that's done, 3,000 more children on the projection will be in the system. Every single day, a local authority, there are 180 children that are given SEN status every single day. Now, that boat is not going to stop. But what we can do is maybe attack some of the low-hanging fruit that can be done very simply, minor changes in legislation. And please, I would implore that you look at the legislation that was brought in the 90s, in a different society, times were different. It now needs to be relevant to this decade. And there are adjustments that need to be made within that, which will have a knock-on effect on the regulations, which we've talked about this morning.
This is the Children's Act you're referring to, or?
Yes. Going through where shall and should be must and will. There are words within there that simple words that could be changed, and the knock-on effect, people have tried, DfE have tried to tweak regulations where they can, and they've done a cracking job, but they are pretty stymied by the primary legislation itself.
Daniel, for-profit standards of care, relationship to out-of-area placements, and, as Andrew's already touched upon, cover this question as well, what government could maybe do to assist financial security in the sector?
Thank you. So on standards of care, we as the CMA obviously weren't best placed to assess that ourselves, so we relied on Ofsted judgments. Looking at those, we didn't see any systematic difference in the standard of care between the different sectors. I'm aware of research, for instance, by Oxford University researchers that does suggest that there may be some differences at a more granular level, but we haven't assessed the validity of that. In terms of the out of area, I do think that reliance on spot purchasing from private providers to the degree that the market currently does lead to an increase in out-of-area placements because of this northwestwards drift of children's homes that Lucy mentioned earlier. So if you're a private provider, you know that you're going to be essentially in the market for spot purchases. You don't know where the children are going to come from. The most cost-effective thing that you'll be incentivised to do will be to set up in areas where property is cheaper and where you have more ready access to a workforce. And those incentives, as we've seen, have pushed providers away from London and the South East towards the North West, for instance. And I think that's a kind of inevitable logic of the way that the market is currently set up. In order to address that, I think, as I said before, it's really the same prescription. Help local authorities move away from these distressed spot purchases towards a more long-term collaborative model, working with what providers from whatever sector to be able to make sure that they have sufficient capacity in their own areas to meet local need.
Thank you. Lucy, those little package of questions.
I think that the correlation between outcomes for children in care across private, voluntary and local authority, I don't think that there's enough evidence to state assertively that private providers are leading to poor outcomes for children in care, that the evidence isn't there. There's the Oxford University study which suggests, as the CMA said, at a granular level that there is some difference. However, both the CMA and the Children's Commissioner said that from their own analysis, there isn't a significant difference. And just on an anecdotal basis, with the commissioners that we work with, they've also told us that they do not feel that there is a significant difference.
Interesting.
Thank you. And then finally, Mark.
Thank you. Just picking up the individual points. I mean, the Oxford study is, as an academic, from previous, I'm very happy to see any research in this area, but I was very disappointed in that study on the methodological level, but also it's arbitrary and it's historic data. I'm interested in the quality today, and the only real measure of quality that we have is Ofsted data, which shows that the sectors are comparable. So, it doesn't really add anything to the debate today looking at data from 10 years ago. But in terms of the drift towards, I'd kind of challenge a little bit on Dan's point in the out of area and where homes are opening. If we look at the DfE data set on net import-export, the Northwest actually only imports about 150 kids versus other areas. So it's not as different as you think. There is a high demand in the Northwest. For example, Liverpool exports 300 odd children. We know that London exports a lot. So there is a mismatch around the country. But why is there a mismatch? I do believe that maybe property prices play a small part, but I think it's only a small part. I mean, Dan highlighted workforce is one. But coming back to the planning, if we look at some of the areas where there has been a significant number of homes open, the hardest journey to go through for planning permissions to go from a traditional residential property to being a children's home. We have providers and members of the Children's Home Association that have in excess of 100, 120 objections. Not in my backyard, NIMBYism rules. However, one of the easiest ones to go for is either from a HMO, a guest house, or some other commercial property to becoming a children's home. So if we look at some of the areas where there's been a proliferation of children's homes opening, a lot of it's to do with planning. So that does create a massive distortion in the market. So I think if we can grasp some of these barriers, then we can start look to say, right, can we get a better match of placement to children's homes around the country where there is need?
Okay, thank you.
Do you think that the government should be aiming to phase out? You talked about the rise in use of semi-independent provision. Is that something that the government should be looking to phase out, or does it have its uses in some circumstances?
We don't feel that it does have its uses. The Care Review recommended that all children in care should receive care where they live by 2025, and we think actually the £145 million initial investment in helping providers of semi-independent accommodation register actually would have been better spent helping them get to the regulatory standard to become regulated children's homes. The reasons that we think that semi-independent accommodation does not have its place in the market is that we fundamentally think that shared accommodation with adults for children, bed sits, and emergency placements like caravans cannot ensure the safety that is necessary for the care system to provide to children who have, by and large, experienced abuse or neglect before coming into the care system. We have supported people in our own care who have been placed in semi-independent accommodation beforehand, and their stories of living in a caravan for multiple months at a time are very harrowing, and actually we don't feel that any child should have to have that experience. So we do not support semi-independent accommodation, the growth of that sector.
Okay, can I come to Mark and then Andrew on that?
We fully support children receiving care up to the age of 18. I think that there may be some children, young people that I would frame as adults becoming that may be right for a less restrictive environment when they get to 16, 17 years old, but I think they're in the minority. And obviously on the financial side, the biggest risk, and this was talked about in the development of the legislation, that we would end up with this kind of two-tier residential, with this supported being used as a cheaper form. And to be honest, I think that the legislation has created a massive problem for Ofsted. I mean, they've delayed the inspections till later this year now. They're going to have a really difficult decision in terms of assessing some of the placements and what is care and what is support. What we do know is that there's several hundred of children subject to a deprivation of liberty order across the country that cannot be in those placements, and there's nowhere for them to go. So we do have a ticking time bomb there. And if I was to predict anything, it would probably be at some point in the next 12 months to 2 years, there'll end up being a judicial review on a child or children that are in semi-independent that should be in a regulated children's home. And I think it will end up, this thorny issue of what is care and what is support will end up being a challenge for a High Court judge to decide. But obviously the ramifications of that will be massive. There's 7 to 8,000 kids in those placements. That's a lot of children's home placements to generate. That's the scale of what we're kicking down the road.
Yes, I'd agree with Mark in terms of Ofsted's got a really difficult job on its hands in making sure that that's... I mean, I have worries of 16-year-olds going into supported living. I really do. But there are some that need to. My biggest fear, and I am going to throw another statistic at you, a third of care leavers experience homelessness in the first 2 years of leaving care. Now, we need to look at the picture beyond 18 in terms of sorting this out. It is unacceptable that an 18-year-old leaving care should be homeless. And it costs local authorities, what, 30 grand a year to deal with a homeless person? Surely that money could be spent better. But I agree the regulation of supported lodgings and what Ofsted are doing. But again, it's a year, 2 years. And I think, as Mark quite rightly says, it will be a High Court judge that decides, what support and what isn't support.
This committee has done quite a lot of work on Ofsted with regard to its relationship with schools. Do you feel it is appropriately resourced to meet this challenge for the care sector?
I'm not sure. I think it's our only option at the moment. I'd certainly think the review of how they're doing is hard. Their resources pretty stretched. I was talking to somebody the other day who had an Ofsted inspection in a special needs school, and the inspector had 4 hours training on special needs. I can't
Something that we highlighted in our report in terms of saying that we need appropriate phase and speciality provision, which I do recognise. We're going to have to wrap up the session very shortly. I just want to ask very briefly, Dan Turnbull, the government obviously accepted the recommendations made in your 2022 market study. Do you feel the subsequent proposals have gone far enough to rebalance the market? And what recent steps has the government taken to further the implementation of those recommendations?
So we were very pleased to see that the government came out and accepted all our recommendations. We would like to see a multi-year commitment from the government to see those through. I think what we've seen so far are encouraging noises in the direction of implementation, but no more than that so far. So if I may, I'd say it's a little early to tell what the impact is going to be, and certainly we're nowhere near where we need to be yet.
Okay, thank you. And finally, what you talked a bit, we've heard a bit about planning, we've heard a bit about the role of health in this and so on and so forth. I mean, it strikes me as an area where interdepartmental cooperation is really vital to try and move things forward for the children's care system. What type of multi-departmental collaboration would make the most difference for this sector? Where would you like to see other departments leaning in to the work of this sector? I see Mark reaching, hopefully, for his mouse. Do you want to go first on that?
So 2 areas that...
Sorry, Mark first.
Apologies.
I mean, this has been a theme over many decades. Access all areas was a kind of big policy initiative, but I think the lead needs to be by the Treasury. If I look at the previous piece of work by the Audit Commission and the University of York, a care leaver that goes on a negative trajectory after care, so without the cost of care, costs the state or costs the Treasury about £3 million for one care leaver. About 10,000 kids, say for example, leave care each year. How many go on that trajectory? I would say at least 1,000. And if you start doing some maths, I can demonstrate that there is a multi-billion-pound of preventable problems that leave care every single year. The value that good quality residential provides is massive. But the problem is we have a structural issue in terms of policy, in that if you're a local authority commissioner, as you heard from DCSs earlier on, etc., where is the return on investment for me to invest several £100,000 with that child or young person at 16, 17 years of age? The costs through adulthood fall to the DWP, Department of Health, Ministry of Justice, not to the local authority. So in terms of the investment, and that's where potentially social financing models come in, etc., but there's a huge financial incentive, obviously with the human cost of children. But it really needs to be led, I would say, by the Treasury.
Okay.
They are the ones that get the time costs.
Thank you. Fair challenge, I think. Andrew, anything to add?
If I had 2 wishes, one would be making sure that the mental health side of things was very linked up, because I think if we can fix that earlier on, that's going to relieve some of the pressure later on. And my other wish would be collaboration post-18. A youngster at 18 leaves one corporate parent and has to approach up to 9 different agencies to sort their life out. And I think that's wrong too. Those would be my 2 key wishes.
Okay, thank you. Dan?
Thank you. So 2 areas. One, as just mentioned, mental health I think is incredibly important for managing that inflow of children into the care system and reducing the level of demand that we're seeing. The second area I'd highlight would be DLUC, where I think the planning issues that Mark really vividly mentioned there are really incredibly important. So I'd like to see a commitment of DLUC working with DFE to ensure that we remove all the barriers to having the right homes in the right places.
And finally, Lucy.
3 areas. The first one being transitions for young people in care, but also for young people with disabilities as well, because 1 in 3 children in our care has a disability. Housing with regards to amending the priority need legislation so that actually young people get priority need to social housing. That would be a major priority for us. And then lastly, mental health, and a dedicated mental health strategy for looked after children is something that we would strongly support.
Okay, thank you very much. I think that's been a very useful session. Thank you for all your feedback. Order.
The proceeding has ended. 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 The proceeding has ended.